I'm Salim Rizai. I'm a ER physician in San Antonio, Texas, and I was asked to answer some questions about what it's like to be on the front lines of this pandemic right now called COVID-19. And so I wanted to go through some of those questions and kind of let you know what my thinking is, what my feelings are, and kind of what my anxieties are. So what's it like inside my hospital right now? It's kind of quiet, to be honest. We have seen a drop off in our patient volumes at this time, and it's not quite as bad as it's been in New York and Washington and many other places of the country. But there is increased anxiety right now and stress because of knowing what is coming. We've seen the reports, we've seen the pictures and the videos from European countries like Italy. We've seen what happened in China. And just reading and hearing about what's going on in New York and talking to many of my colleagues that are up there, I would say that it's the stress and anticipation of knowing what's coming and it not being here yet. The stress of, are we prepared enough? Do we have enough resources? Are constantly crossing my mind. Are there things that we can do that potentially are going to harm so many patients that are coming in, as well as friends and colleagues that I work with? How do you feel every day when you come to work? For me, it's scared and anxious. And to be clear, it's not scared and anxious because I'm worried that I'm going to catch COVID-19. I've conceded the fact that I will most likely catch this. I'm scared and anxious that we're going to run out of resources and we're not going to have enough equipment. We're not going to have enough oxygen. We're not going to have enough personal protective equipment to care for so many people that need it. And I'm fearful that we'll get to a point that I'm going to have to be the one making decisions on who actually gets treatment and who doesn't. And the psychological and emotional stress of worrying about that weighs on me every day, whether I'm at work, whether I'm going into work, while I'm at work, I think are the kind of the biggest things. The sorts of things that I am discussing with my colleagues really involves around three things. The first is, what is the best evidence that's out there to take care of these patients in a safe and efficient manner? The second is, how can we change the layout and the workflows of our department so that we can handle the surge of patients that are inevitably coming? And then I think the biggest and the toughest for me is the fear of transmission of this virus to my family members. I have a mom and dad, both who are 70 years of age. We know that older people are at higher risk of catching this disease and getting very sick and even dying from this disease. And it has led me to actually quarantining myself from my family. I actually don't spend any personal time with them. We use technology now and do lots of FaceTime, but that loss of human contact, being able to hug my parents and telling them how much I love them in person, are probably some of the biggest things that many of us discuss that work in the emergency department. The experience of taking care of people with COVID-19, this is really difficult for us in the emergency department because oftentimes we don't know if people have COVID-19. First of all, the tests are a very scarce resource, and even when we do have them, the results don't come back oftentimes for days. On a good day, maybe we'll get the results back in several hours. So we have to just assume everybody has it. The constant watching out for not contaminating our work environment and cross-contaminating with other patients is unbelievably hard. We have to constantly wear masks. We have to wear eye protection. Depending on how close we have to get to patients or resuscitations, we have to put on kind of the full type of suit that you see in the movies, and washing hands. My hands are so raw and cracked from all the hand washing. It's unbelievable. And having to worry about this for every single patient that comes in the department over a 10 to 12 hour shift over several days in a row is not only daunting, but it's mentally and emotionally challenging. So specifically, what's going on in our department in terms of changes to prepare for this? I think the biggest thing for me is that we have completely changed the layout of the department. Whereas we used to have 40 plus beds in the department that I work in, we've now split the emergency department into a respiratory side and a non-respiratory side. And we've started putting patients into different cohorts based on how they get triaged. Having a tent outside the emergency department where patients come in, kind of tell us what their symptoms are, and then deciding which side of the department they go into. And then, I think one of the most fascinating things is the use of technology, the use of telemedicine, talking to people on iPads and trying to get their symptoms, much like I'm recording this video, without actually being in person. The toughest thing for me, though, is that as we get more information, the number of updates we get are more than daily. I get about 30 to 50 emails a day, just COVID-19 related. And policies change, and the level of protection that we need to use and how we're doing things in the hospital system constantly are changing. And so in addition to caring for these people, keeping up to date with that information is also rather difficult. I never thought I would love PPE so much, personal protective equipment. It is a scarce resource. We're running significantly low. We've been asking people for donations. Many people have gone online to Amazon and started buying their own personal protective equipment because we're running out. And it's difficult because, it's hard to take care of patients if you can't even protect yourself, because you're no good if you get sick, and you're even less good if you get everyone around you sick. And this has been a huge burden on the front lines, is making sure our workforce is healthy and able to care for as many as possible without getting sick ourselves. And so I think that the need for donations for more personal protective equipment is very, very much needed. And there are many places that are having to figure out homemade workarounds, like using trash bags, which is an amazing thing to me in a country like the United States. And so it's sad that we've gotten to this point, but I hope that we learn from this in the future. My biggest fears with this pandemic are twofold. Number one, by far and away, is potentially catching this and passing it on to my family, watching them get sick and maybe even dying. And that's something I think about every day when I'm at work. And I couldn't live with myself if I did that to somebody in my family, or to a friend even, for that matter. So that's probably the biggest thing that I am kind of afraid and concerned about. The second thing that just haunts me in my dreams is, if we run out of resources, having to practice what's called wartime triage, where it's now in my hands to decide who gets treatment and who doesn't. And I definitely did not go into the practice of medicine to play God, and nor do I want to. I just want to treat people as best I can and take care of as many as I can. But I fear for the day that we run out of resources and now it falls in our hands to have to make these decisions. I'm not sure how I would overcome that or get over that going forward in my life. The final messages I want to leave for everyone is that don't take this pandemic lightly. This is not just the flu. This is not another viral illness. I mean, we are seeing numbers going up amazingly fast, almost logarithmically, just doubling every day. People are dying from this, and this is something we're going to talk about for many, many years to come, about the COVID-19 pandemic. The two biggest things you can do is staying home, trying to stay out of hospital facilities if you don't feel that you are in a life or death situation, and not letting your own anxieties drive you to come in. And then social distancing is so important, keeping your distance from people, washing your hands. If you're having symptoms, wearing a mask so that you're not passing that infection on to somebody else. Those are kind of the biggest things. And although it's backwards for me to say, don't come into the hospital or come into the emergency department, I kind of want to explain my reasoning for that to kind of close this off. The first thing is that if you have the infection, I certainly don't want you passing that infection to somebody who's higher risk and could potentially get sick and die from that. The second part of that is that if you don't have COVID-19, I certainly don't want you to pick it up while you're at the hospital, which is a high risk of happening in an environment like that where we're seeing so many sick people. And then the final thing is that because we're running so low on personal protective equipment, for every person who comes in, we have to wear a mask, eye protection, gowns, and gloves. And for every person we use that for, those end up getting thrown away. And we start running out of that resource. And now we don't have any more left to care for people when they actually need it. And so for the first time in my life, I am asking for help from everyone. And that help comes in the form of practicing the things that we know make a difference right now and trying to flatten that curve of the number of people who are infected so that we don't completely debilitate our health systems, that we are able to continue caring for you. And hopefully in the future, we have some treatments and some vaccines that we can actually use, and this will all be a moot point. Thank you for listening. Again, I'm Salim Rezai, an ER physician in San Antonio, Texas. As I tell a lot of my colleagues back home, stay safe, one day at a time, one patient at a time. We're all in this together.